Amyotrophic lateral sclerosis and frontotemporal dementia are multifactorial disorders with a complex interplay between genetic and environmental factors. The clinical spectrum of both of the diseases are complex and often overlapped. A few genes encoding for a variety of proteins with different functions have been identified to play a key role in pathogenesis of ALS-FTD. In particular, nonsense and frame-shift mutation of tank-binding kinase 1 gene TBK1 have recently been associated by both familial and sporadic ALS-FTD. We present a case of a 42-year-old man developing progressive gait instability followed by motor clumsiness in fine movements. His past medical and familial history were unremarkable. Clinical examination revealed diffuse hyposthenia of upper and lower limbs, hypertrophy of first dorsal interosseous muscle, hyperactive reflexive, positive Hoffmann sign, and bilateral palmomental reflex. An electromyogram confirmed the diffuse fasciculations associated with acute denervation in a clinical picture compatible with ALS. After being tested for mutation in different genes, we performed a next-generation sequencing analysis which revealed an heterozygous missense mutation in TBK1 gene, previously reported to be pathogenic due to exon skipping of exon 11. TBK1 is a multifunctional kinase implied in several processes such as regulation of immune system, inflammation, and autophagy. TBK1 loss of function mutations are rare in the European cohort and are associated with ALS-FTD disease. In particular, in a case series of 27 patients with loss of function mutation or possible pathogenetic missense mutation of TBK1, 15 and 12 had a presenting diagnosis of FTD, especially behavioral variant FTD and ALS, respectively, and the majority of patients had a positive family history for dementia or motor neuron disease and FTD at diagnosis. Of note, other clinical parameters such as site and age of onset and disease duration greatly varied among patients. It is worth to consider that our patients have no other signs of FTD but bilateral palmomental reflex. So there is an urgent need to identify genetic mutation as they can give insight of the different pathogenetic alterations that leads to ALS. TBK1 mutations should be assessed in both familial and sporadic cases of ALS, regardless of clear evidence of FTD.